So my topic is Spina ventosa. What is Spina ventosa? Tuberculous dactylitis is a skeletal manifestation of tuberculosis, one of the commonest bacterial oocysts. It affects the children more often than adults. The first radiological description of this condition is credited to Felchenfeld in 1896. However, the first histological description was given by Rankin in 1886. The Swedish botanist and physician Carl von Linné was the first to mention the condition by the name Spina ventosa in 1746. Multiple bones are involved in children, and usually a single bone is involved in adults suffering from tuberculous dactylitis. Tuberculous dactylitis affects the short tubular bones of the hands and the feet in the children. It often follows a mild course without fever and acute inflammatory signs as opposed to acute osteomyelitis. There may be a gap of few months to 2 to 3 years from time of initial infection to the point of diagnosis. History. The spina ventosa is the term given for tuberculous dactylitis. Nearly 85% of the patients of spina ventosa are below 6 years of age. Bones of hands are more commonly involved than those of the feet. Proximal phalanx of index and middle fingers are commonest site of the involvement. Up to nearly 7% of children with pulmonary tuberculosis may develop this condition. Spread to skeletal muscles system is developed to believed to occur via blood and lymphatics. Clinical presentation of the spina ventosa. As you can see that the tubercular dactylitis involves the short tubular bones of the hands and feet in the children. It often follows benign course without pyrexia and acute inflammatory signs. In contradistinction to acute osteomyelitis. In this figure, we can see the middle finger is been tuberculosis dactylitis and it's a patient of spina ventosa. The radiographic features. The plain radiography is the modality of a choice for evaluation and follow-up. The bones distal to the tarsus and wrist tend to be affected, with the upper limb being more commonly involved. Typically, the proximal phalanx of index, middle finger, and the ring finger metacarpals are affected. Characteristic features include that the bone shows a diaphyseal expisal lesion. Periosteal reaction is uncommon. Healing is by sclerosis, which is actually gradual. Here you can see the X-ray of the dactylitis patient. The differential diagnosis for the spina ventosa is that it includes the pyogenic or the fungal infections like syphilitic dactylitis, sarcoidosis, hemoglobinopathies, hyperparathyroidism, leukemia. The sausage digit refers to the fusiform swelling of the digit due to the soft tissue inflammation from underlying arthritis or dactylitis, and psoriasis is one of the common important cause. The other important etiologies are the tuberculous dactylitis, spina ventosa, and sickle cell disease. Thank you.